Hello and welcome to St George's Advanced Patient Simulation and Skills Centre. My name is Nicholas Gosling. I'm the co-founder and head of the GAPS department. I really hope you enjoy this interactive tool that's been designed and filmed by the team in GAPS themselves and edited by our very own simulation and skills technician, Mr. Gary Allen. The GAPS team consists of 10 full-time substantive staff, 2 clinical directors, 2 clinical simulation fellows, 1 full-time educational fellow, and over 100 interprofessional medical, dental, surgical, nursing, and AHP faculty. The GAPS team provides oversight and direct support to local clinical education initiatives and provide expert support in technology-enhanced learning, supporting the many clinical faculty educators to develop skills in simulation-based teaching and learning. Out of the 253 working days, the department works incredibly hard and annually produces over 330 individual courses with an average of 1.4 courses per working day. It's not unheard of to find 4 courses at the same time running through the centre. Out of those 330 courses, we routinely have over 1,000 faculty and over 4,500 participants coming through the centre each year. Since starting the department in 2000, this is my second build within St George's, moving from the Postgraduate Education Centre in 2011, after we successfully designed and commissioned this state-of-the-art simulation and skills centre as a joint project between the university and the trust. We've since added a further 2 dental simulation training and technology suites in 2013 and 2018, providing us now with over 600 square metres of technology-enhanced learning and teaching space. Our educational programmes, scheduling and course delivery is both facilitated and supported by expert technicians, clinical skills and dental coordinators, and administrators and educators across postgraduate, undergraduate, medicine, surgery, dentistry, nursing, and AHPs, utilising 3 main components: high fidelity simulation, both fixed within the centre and mobile, out in the clinical environment, out in the community, and occasionally out of the country. Part-task clinical skills practice and training, again, fixed within our clinical skills laboratory, which can be dry or wet lab, or mobile facilities, which can be booked through our web page and picked up the following day. Open forum and seminar lectures, which educationally support faculty development, encouraging self-reflection and peer-reviewed feedback in a psychologically and clinically safe environment.
Hi, my name is Ilenia. I'm the Simulations and Skills Specialist here at GAPS. I've been in post for only 6 months, but I can clearly say that this was one of the best decisions I ever made. Apart from having an interest in education, someplace I can work with such a wonderful team. My main job is to oversee and give direct support to enable a safe and attractive environment for our staff and to provide expert support in technology advanced learning. I'm responsible for managing and leading the center staff and to provide development for our staff as a clinical teachers. My background is hematology oncology. I was the practice educator here at St George's, and I'm pleased I can bring some of my expertise here into GAPS.
Hi, I'm James. I'm one of the clinical simulation specialists at the GAPS Centre. I joined in July, so quite new to the team. I'm a speech and language therapist by background, and I was the Trust's mental capacity lead. So I'm really interested in complex communication, behaviour, and looking at simulation in those contexts. Great team, really close-knit, highly skilled, and it's a pleasure to work here.
Heading towards the main office, where the hard work happens. Hi everyone, and here we've got Pippa, our lead administrator, and Manana, our administrator. This is Charles, our clinical skills coordinator, and this is Yoni, our dental program coordinator. And the empty desk you see here belongs to Ivy, who's our other dental program coordinator, but she's currently in Ghana and can't be with us. Thank you, everyone.
What are you talking about?
My name is Dr. Asanga Fernando. I'm the clinical director of GAPS, as well as being a consultant cancer psychiatrist employed by St George's and the trust co-lead for cancer survivorship here at St George's. As part of my leadership role as a clinical director at GAPS, this involves a role in quality improvement, research, patient safety, evaluation metrics, faculty development, human factors, and crucially future care models as well. And as part of the latter, we've been really lucky to work with our staff, developing some fantastic clinically relevant courses and programs which have been evaluated, published, and presented often at European or international conferences. Our Cancer, Mental Health and End of Life Care program, CAMELS, has been one of these that's had real clinical impact and has been a unique faculty collaboration between oncology, palliative care, nursing, acute medicine, and mental health. The results of these have been presented at global forums, including psychiatry and oncology conferences at both European and international level. But more importantly, its impact has been local in terms of clinical management on patients with cancer and mental health comorbidity, preparing patients for better end-of-life care, as well as attitudes around mental health. Now, during the COVID-19 pandemic, we've adapted and developed a series of innovative palliative care and remote communication courses, which have also been presented to wide audiences and have had local impact as well. We've also worked with our colleagues in the Mental Health Trust during this time and are particularly excited at the moment in terms of bringing together a collaboration around cancer survivorship. And I guess what's key about these particular programs, which actually form a small part of our overall sort of course portfolio, is that we're mapping simulation onto the changing face of healthcare and anticipating what a post-COVID world would look like clinically. So how do we actually prepare our staff to better serve our patients in that environment? And that said, we're also very keen to better co-produce interventions with more patient-led involvement. So ultimately, we aim to look at what I call the 5 I's. Are the interventions that we develop important clinically? Do they encourage integration and interprofessionalism of staff? Are they innovative? And crucially, are they inclusive of patients? And importantly, do they actually improve things for staff and patients by being there? Thank you very much.
Hi, I'm Gary, the simulation tech here at GAPS. I started working here in 2017 after moving from my previous role as an operating department practitioner. Currently within the centre we have 9 mobile patient simulators which I help to run and maintain. These are often utilised by clinicians throughout the trust to run in situ simulations in their own clinical areas. I've always had an interest in technology, and one of my roles here is to advise the best way we can use the technology we have within the centre. And I also draw on my past clinical experience to try and create scenarios which are accurate and immersive for the learners. This year we've started collaborating with a number of clinical teams to try and create a variety of 360 learning video resources. And we have recently completed a project working with a multidisciplinary team down in the cath lab running some heart attack scenarios, which you're just going to see a quick clip of now.
A guide to heart attack calls in the cardiac catheter labs. This guide will take you through how to manage 2 common scenarios you'd be expected to deal with in the cardiac catheter lab. It's a 360 video, so allow the user to look around the lab whilst the video plays to give you a better idea of the environment and personnel who are in attendance. The first scenario is following a heart attack bleep, where the heart attack team assemble in the cardiac catheter lab to meet paramedics who have brought in a patient following an out-of-hospital cardiac arrest with a suspected myocardial infarction. The second scenario is when a heart attack call is put out mid-primary PCI in order to call for anaesthetic support.
Hello. Thanks. Matt, when would you like a handover? Before or after transfer? Before, absolutely.
Okay, everyone listening to everyone here. This is Brian. He's a 47-year-old gentleman. He has an out of hospital witness cardiac arrest.
Hi, my name is Yushin. I'm one of the simulation fellows, and I also work in Neuro ICU. Like Mark behind the camera, we help up with medical student teachings. We help up with meerkats, which are teaching for IMTs and for foundation doctors. I also have a personal interest in clinical human factors and patient safety, which I'm doing a master's on, and I'm looking forward to work with you.
Hi, I'm Mark. I'm one of the new simulation fellows up in the GAPS suite here. So I split my time working within GAPS and simulation and also within general ICU. So within GAPS, I work on the meerkats courses, providing simulation for the IMTs, the FY doctors, along with nurses and healthcare assistants. And then I'm also involved in the medical school teaching. And then whilst in GICU, we've also recently started an in-situ simulation course where every Tuesday we're taking the mannequins down and doing a simulation within the actual intensive care unit, which we're hoping to continue further and maybe roll out to the other units. Hopefully looking forward to working with you all.
Hi, my name's Heward. I'm an educationalist here at GAPS, where I work closely with clinical staff on faculty development and embedding educationally driven, clinically relevant change.
Charles Beatty is the Clinical Skills and Simulation Coordinator here at the GAPS Centre. We have 2 decades worth of skills training as contributors and developers, some of the first surgical skills training programs in the world. We run a variety of courses accredited by professional bodies. For instance, our Airway Refresher for Anaesthetic Consultants and Airway Refresher for Anaesthetic Trainees ST3 and ST4 courses are recognised by the Difficult Airway Society. Also, we run joint Advanced Trauma Life Support course, ATLS, and Advanced Trauma Nursing course, ATNC events, standalone ATLS provider courses, and Care of the Critically Ill Surgical Patient CRISP courses, all of which are certified by the Royal College of Surgeons. Furthermore, our 2-day Cardiac Advanced Life Support CALS courses are verified through CALS UK. We also deliver bespoke courses such as the Master Physicians Associates, MPAS Wound Debridement and Suturing courses, as well as surgical skills for medical students events, both of which are for students of the St George's University of London. The department runs around 33 clinical skills series that result in over 125 sessions annually.
Hi, my name is Michael Puntis. I'm one of the clinical directors here at GAPS and an intensive care consultant. My main focus here in GAPS is looking at the relationship between simulation and patient safety, both how simulation can inform us about some of the risks that we face and also provide a way of improving both individual performance and team behaviours.
Early in 2020, when COVID-19 hit us, as with you and all your centres, our simulation and skills training environment immediately changed. We had to cancel all courses and training in order to meet the COVID-19 response needs for staff within St George's being deployed to critical care environments and other acute medical wards. This slide is a brief overview of the GAPS portfolio of training and learning programs that they designed in response to COVID-19 and our staff needs. The GAPS team were awarded a special achievement of recognition for their work on this program. This slide is dated from March to June 2020, where roughly 3,200 people were trained across a number of simulation and skills educational programs that have been designed with the Director of Medical Education, nursing and intensive care medical leads and other speciality leads in response to COVID-19. Some of our programs came about towards the winter of 2020, like our palliative communication training, which was in response to direct clinician needs in managing COVID inpatients who are not for escalation. Our face-to-face training during lockdown from September all the way through to 2021 ebbed and flowed, but was greatly assisted by the GAPS team creating a COVID-19 secure environment and risk assessment that allowed us to continue delivering both COVID-19 response training as well as HEE speciality training and mandatory Royal College of Surgeons training and dental foundation year training.
Here at the GAPS Centre, we run 3 cohorts: CPD, Dental Foundation Trainees, and Dental Core Trainees courses. CPD primarily tends to be dentists in London who attend our CPD courses, DCT, dentists attached to our MaxFax unit at St George's, and DFT, Dental Foundation unit who are based in dental practices in South West London who attend courses with us once a week. This year, in 2021, we project running over 150 dental courses at the GAPS Centre. Many thanks and look forward to welcoming you all at your next visit.